So we record the bite and we need to determine what vertical dimension. So I'm going to start. I've given the patient her old dentures. She's wearing her old dentures and I'm going to draw a dot on her nose. And a dot on her chin. And I'm going to ask her to bite together. Bite. Stay bite. Relax. Relax. And what am I measuring? I've asked the patient to bite together with her existing dentures. We can see she's a little bit overclosed, but I have measured their OVD.
ឥឡូវយើងវាស់បាន occlusal vertical dimension ហើយអានេះគឺ resting vertical dimension យើងឃើញមើលទៅប្រហែលជា2ទៅ4 mm is 2 to 4 mm.
No, that's probably about 10. Okay, so just relax. So I check several times. Just lick your lips. Relax. Just so we can see these marks. Can you see the marks on the patient's face? Yeah. And when I come, they line up exactly. So that's our resting vertical dimension. I've recorded our OVD. And we've got a freeway space here. If I was to measure that, it's about 10 millimeters. It's too big. So that tells us when the patient closes together, she looks overclosed, doesn't she? So with the new dentures, I want to reduce the freeway space and I'm going to open her up. So she's somewhere in here. And remember, she's a class 2 div 2, so I want about a freeway space of 4 millimeters. Okay.
អញ្ចឹងដោយសារយើងឃើញថាដោយសារតែមិញហ្នឹង freeway space គឺធំជាង2ទៅ4ប្រហែលចង់ចូល10 mm អីចឹងប្រហែលជាអញ្ចឹងហើយបើអ្នកជំងឺយើងខំទៅចង់ចូល over close អញ្ចឹងយើងត្រូវកែតម្រូវ
So I'm just going to try my blocks in now, and I'm going to try the lower one in. And as I look at it, just remember, I think it might need a little bit of wax adding onto it because the incisal plane is sitting below the lower lip. Okay, so I might just add a little bit.
គាត់ថាប្រហែលជាត្រូវថែមតិចទៀតដោយសារតែ incisal plane របស់យើងហ្នឹងនៅពីក្រោមបបោមាត់ពេក
Comfy? Okay.
ក៏មិនដែរមកនិយាយអត់អីណា
Let's have a look at the upper one now. So, I'm just looking to see. We can see the incisal edge is just sitting below the upper lip, 1 to 2 millimeters. So that's looking good. And we've got nice lip support here. That looks good too. We've got 90 degrees. Okay, we're looking at that nasolabial angle. In fact, we might have just a little bit too much wax here when I look at it. It might be too long. Okay, so I might take some wax off there. I'm just going to try the lower one in now too. Oops. Can you see that the patient is hitting at the very back? And so I'm going to need to take some wax off. The blocks aren't coming together.
យើងឃើញថាអាពុំហ្នឹងកលខាងក្រោយអញ្ចឹងប្រហែលជាយើងត្រូវកាត់ខ្លះហើយ ហើយថែមមុខទៀត
So what's happening is when the patient bites, she's hitting there, like that. So I'm going to take some wax off. So this is melting the wax. So I'm taking more wax off at the back than I am at the front, and I'm just going to come and try this back in now, and we'll see how we're going. Okay. So, too hard. So I still need to take wax off. Sometimes what I do is I just compare the old denture and the new denture. Just compare. Oh, it's very dark.
អញ្ចឹងគាត់យកអាចាស់មកថ្មីទៅប្រៀបធៀបគ្នា
And this time, I'm just going to take some wax off the bottom one.
ហើយលើកនេះគាត់យកកម្រួនចេញពីខាងក្រោមម្ដង
When I look at this, I can see the wax is a little bit high. So I'm just going to take it off at the back.
អញ្ចឹងគាត់កាត់កម្រួនខាងក្រោយចេញខ្លះដោយសារតែវារៀងខ្ពស់បន្តិច
And I try to take the wax off at both places at the same time.
គាត់ព្យាយាមយកកម្រួនចេញហ្នឹងយកទាំងសងខាងក្នុងពេលតែមួយ
So what I'm doing is I'm removing wax from the retromolar pad. It was too high up on the retromolar pad, and I'm just going to take a little bit more off. So I've exposed the retromolar pad, and I'm going to do it on this side too. Just going to take wax off, and we'll try again. And we're getting better. Open. Might just take some wax off. Remember I talked about heel clash? And sometimes we need to get the wax off at the back here. So I'm just going to take this wax off now and we'll try it back in.
យើងកាត់ថែមបន្តិចទៀត
And I like to make sure there's lots of water on here so we have a good seal. And the denture, this base is actually sitting nicely, and when I push on it, I can hear some noises being made. So we're generating that negative pressure, some retention.
យើងឃើញថាតែច្រើនគឺវា fit បានល្អហើយនៅពេលគាត់ហុញដីទៅយើងបង្កើតបានជា negative retention ដែលវាបង្កើតជា retention បានល្អ
Now we've got an anterior open bite, just lips together. So in the video this morning, we saw the dentist adding wax to the blocks. So I'm just going to add a little wax to this lower block to try and get things biting more evenly.
យើងឃើញថាវីដេអូខាងនេះយើងឃើញបែកឃើញគេដាក់បែកចូលប្លុកឥឡូវយើងទៅធ្វើដូចគេដែរដើម្បីឲ្យព្យាយាមធ្វើឲ្យការខាត់ហ្នឹងស្មើគ្នា
So you can see in this existing lower denture, the lower teeth are quite high, and we've got an anterior open bite at the moment. So I need to add some wax here. That's what I'm going to do.
អញ្ចឹងដោយសារតែយើងមាន anterior open bite នៅពីមុខចឹងគឺយើងថែមវាបន្តិច
Now every time you add wax, it's different for every denture. You've got to be thinking about what it is you want to do, what it is you're trying to achieve.
ដោយសារតែ denture មួយវាខុសគ្នាទាំងអស់ចឹងការដាក់ wax ហ្នឹងវាមានភាពខុសគ្នាដែរអញ្ចឹងយើងត្រូវគិតថាយើងចង់ធ្វើអីឲ្យបានច្បាស់
So I'm trying now to give myself some extra height. And that's what I'm doing. And now I'm just going to try and level it all out.
ដោយសារតែថ្មីចាំជ្រៅពេកអញ្ចឹងទៅធ្វើឲ្យអ្នកជំងឺយើងមាន over bite អញ្ចឹងលើកនេះយើងព្យាយាមធ្វើឲ្យ over close ដល់ពេលអញ្ចឹងលើកនេះយើងខំធ្វើវាឲ្យបានទីរះទីដើម្បីឲ្យស្អាត
And your spatula needs to be quite hot to melt the wax. It's no good being cold, it's got to be hot.
ហើយ spatula នេះមិនត្រូវធ្វើវាឲ្យក្តៅដែរដើម្បីនិយាយមួយ
The other thing is it's good to melt the wax on a tray and on the desktop.
គាត់យើងល្អបើសិនជាយើងនិយាយមួយលើត្រេគ្រាន់បើជានិយាយមួយទៅខាងលើតុ
Now, can you see how suddenly the blocks are coming together?
អូខេឥឡូវយើងឃើញថាប្លុកយើងបានចូលគ្នាស្មើហើយស្មើហើយ
And I need to check, now I've got the blocks coming together nice and evenly, I need to check my vertical dimension. Yep. And I've increased the patient's vertical dimension. There's her old vertical dimension, and I've opened her up a little bit.
យើងឃើញថា vertical dimension ហ្នឹងគាត់ធ្វើវាខ្ពស់ជាងមុនបន្តិចឯងគ្រាន់តែជាងការលើមុនដែរ
And so when I look at her lips, I can see her lips are fuller. They're looking better. Yeah.
យើងឃើញថាប្រព័ន្ធគាត់មើលទៅពេញស្អាតជាងមុនច្រើនអត់មាន over close ទេ
What I am seeing though is that her upper lip might need to be pushed out a little bit more.
Yes, ចឹងយើងឃើញថាគាត់និយាយថាថ្មីប្រព័ន្ធមកខាងលើនោះប្រហែលជាត្រូវរុញមកក្រៅបន្តិចទៀតហ្នឹងហើយត្រូវថែមប្រព័ន្ធថែមតិចទៀតដើម្បីឲ្យប្រព័ន្ធមកចេញមកខាង
Can you ask her to count to 10? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Instead of count to 10.
In Cambodian.
There are no
Cambodian word that the sound is different. The sound
Oh,
is different.
okay.
Just say
Can you say fish? Say fish.
ông gì đó fish.
Fish. Fish. Fish. Okay. Pop your head back.
Đây
Head back.
tôi nhỉ, ông đây.
Bite. Open. Bite at the back.
Nhưng cái khả năng cái trôi tới không tiền cho các bên trong này ta lên trên mặt thẻ đi. Alo chừng nào.
Nice. Oh, look at that smile. That's looking good. Now, just
But-
smile.
Anh nhâm vào mình.
Yeah. Oh,
Wow.
okay. Just- So I've increased the vertical dimension, which is what I want to do. Just working to get my incisal plane and interpupillary plane parallel.
ឥឡូវគាត់ចង់ឲ្យអា occlusal plane ជាមួយនឹង interpupillary plane នោះខ្សែនឹងស្របគ្នាបើសិនគាត់ព្យាយាមធ្វើឲ្យបានចឹង
And what I'm doing, it takes many years of practice to get good at doing this. And so if I use my tongue depressor, can you see my lines are parallel?
យើងមើលទៅ parallel អត់អាពុករវាង
Parallel? Parallel? Yes? So I've increased my vertical dimension and I've still got quite a good freeway space here. And I think that's where I'm going to build things to. I'm going to leave this patient with a bit of a freeway space, a bit bigger than what I normally would because she's used to quite a big freeway space. But when I look at her wet-dry borders are coming together really nicely. Kenny thinks I need to add another layer of wax to bring out this top lip. I don't know. I think, smile? Oh, see, that's nice. I think that really is a lovely smile. And I think if I put another layer of wax on there, it will make the block drop. Okay. What do you think?
bánh đa.
Okay? Nice? What I'm going to do is I'm going to take my blocks out. Just keep this image in your mind. I'm going to take the blocks out and put her old dentures back in and see if you see a difference.
ឥឡូវគាត់ឲ្យយើងចាំរូបភាពហ្នឹងទុកបន្ទាប់មកក៏ដាក់ដែលឈើចាស់ចូលចាំមើលថាមានភាពខុសគ្នាយ៉ាងណា
See the difference?
យើងមើលទៅមានភាពខុសគ្នា
See how I've actually built out her upper lip? But can you see how overclosed her lips are? So with the blocks, I've made my patient's lower part of her face look younger. Yes?
យើងឃើញថាអាបងដែលយើងធ្វើនោះឃើញថាអ្នកជំងឺពាក់ទៅមួយនេះក្មេងជាងមុននេះយើងធ្វើមិនអានេះទេចាំតែចាំ
My one doesn't fall down.
មកចង់បើគិតទៅមកម្ដងមក5ដងដែរហ្នឹងតែបើមែនតើធ្វើមួយថ្ងៃហើយដូចគ្នាបានតែបងមែនតើគេមិនបានលឿនអញ្ចឹងទេចាំពេល
Old? Your lips thin. Show you the new one.
ហើយធ្វើពីដង
អានឹងវាធ្វើឲ្យឃើញនេះច្រើនជាងគាត់បានជាងមុន
Good?
មិននេះស្លាញ់
Okay?
អូខេ
Yeah.
ខ្ញុំវត្តកា
She's worried about that line.
ធ្វើតម្រូវឲ្យក្រៅភាពគាត់ឲ្យ she quite happy now
Yes. Her speech is nice and clear too, isn't it? So she's got a good freeway space. Yeah. Okay. So what I'm going to do now is just hit back, just bite.
ខាំ report send all យើង
I'm just going to mark the center line.
តើមកធ្វើ centric មែនកំណត់ mid line វាឲ្យបានខាំបាយ
and the canine. So what I'm about to do now is record the bite. I'm going to take centric relation, okay? So I'm happy with my vertical and horizontal planes. I just want to show you all that my patient is very comfortable with her upper denture. It's staying up while her current one's falling down. And can you see the difference between them? See how I've made the denture base bigger. So what do I have? I have maximized support. Support.
ដោយសារយើងឃើញថាអាខាងលើនោះអាថ្មីពេលយើងដាក់ទៅវាអត់ជ្រុំទេហេតុផលដែលវាអត់ជ្រុំនោះដោយសារតែយើងធ្វើវាទីធំជាងអាចារ្យហ្នឹងទៅយើងបាន support ធំបំផុតដែលយើងអាចធ្វើបានអា support អាចកម្រិតអាបេតា
So now what I'm going to do to record my centric, I'm just going to cut my V notches. So I've got some nice V notches there.
គេថាកាត់អានោះអត់មាន undercut ទេបងនិយាយទៅកាត់អា V ហ្នឹងអត់មានដើម្បីយើងដកបានយកទៅវាមិនមែនតតងណាស់ហ្នឹងទេបើយើងកាត់ undercut
I'm just going to put a little V notch at the back here. A little V. I don't want that coming off. That's it. So not very much of the bite registration material, very thin. And I'm just going to pop this in.
ទៅមកដោយសារតែយើងចង់យកវាទៅតឡាននៅ2គីឡូតែអញ្ចឹងអត់ចាំបាច់ពេក
All right.
ឥឡូវយើងគ្រាន់តែ check ថាវាអាក្រោយនេះវាអត់ទាន់ប៉ះគ្នាទេ
Not touching. And we're going to separate it now.
បើសិនជាអាក្រោយនេះប៉ះខុសហើយអត់ត្រូវទេ
And we can see our V notches. And we've got a nice flat record. And we're just going to check it. Check it in the mouth.
ឥឡូវយើងបានបាយយើងចាប់ដើម check ម្ដងទៀតជាមួយអា V ដែលគាត់កាត់យើងសាក់យើងយកទៅ check ជាមួយនឹងអា V ដែលគាត់កាត់ហ្នឹង
So our patient's helping and it's come off. And I just need to make sure it's back in the V notch. Yep. That's why we put V notches top and bottom. So if the record comes away from the block, you can re-sit it back on.
ហាត់ផលដែលយើងដាក់វាពីខពីលើពីខហ្នឹងដោយសារតែជួនកាលទៅអាវារហូតទៅអាចដាក់វាវិញ
So that's reproducible. She's biting in the same place every time.
ចឹងថាបើសិនជាយើង record ទៅមានថាទៅពេលដែលខំទៅអាកន្លែងខាងគឺវាចំកន្លែងដើមវិញដូចគ្នាអានថាយើងធ្វើត្រូវដែរ
So I'm happy with my bite record. And what we have to do now is choose some teeth. And what I'm just doing is checking to see our patient existing denture is edge to edge. So that's where we will be setting her as well, edge to edge.
យើងឃើញថាពងចាស់របស់គាត់ហ្នឹងពងរបស់អ្នកជំងឺចាស់របស់យើងគឺថ្មីលើមួយថ្មីក្រោយថ្មីមុខហ្នឹងខំទៅកលគ្នាដែរនិយាយអញ្ចឹងទៅគឺយើង set up ថ្មីគឺយើងអត់ឲ្យអញ្ចឹងទេ
And the next question is, would she like her teeth the same colour and shape?
មកយាយចង់បានពណ៌ថ្មីចាស់ឬក៏រៀងចង់បានថ្មីដដែលមិនឬក៏មិនដែរ
Lên mình đi nè.
បាទយកពណ៌
Bò đấy hả?
Dạ.
Bò bé vô phần nắng các bạn. Cũng ỏi sò cái
So I'm just going to take a photo of them.
ឥឡូវយើងបាទអ្នកយើងមិនយើងសួរអ្នកជំងឺថាគាត់ចង់បានថ្មីពណ៌អីឬក៏រៀងមិនគាត់ថាយកអត់ដដែលអញ្ចឹងយើងគាត់ថតរូបថតដើម្បីឲ្យទៅ
Here we go. We can see that we've got a slight reverse overjet here, but that's all right. We're going to set the teeth back slightly, okay? So we get edge to edge, and might mean that we just bring those front teeth forward a little bit, okay? Which will help to reduce some of this and still give us nice lip support. Okay. So we've done very well. Can we give our patient a round of applause, please? And we are done for today. And we're going to bring our patient back tomorrow at the same time.
Yes, yes.
And we will try and the setup.